So I don't know how many folks are in the room, but I think we're waiting for the previous session to end before we get started.
They are wrapping up now. If you want to wait until the little eyeball is maybe 10 or 15, I think that will kind of signify that enough people have trickled over.
Okay, what little eyeball are you referring to?
It's next to the leave button and the recording button. If you're sharing your screen, you might not be able to see it.
No, I got it. I see it at 6 now.
Okay, yes.
Okay.
Great,
That's
thank
great.
you. It looks great.
Is sound okay?
Yeah.
Okay. And this ends at 1:40, right?
Well, since we were starting you a little late and you're the last session, I think it's okay if you go just about 20 minutes from your start.
Okay. I just didn't want to keep folks from getting, I know some other sections are still going, so wanted to give folks a chance to switch if they needed to.
Yeah. Yeah, if you're able to be faster without cutting things that you feel are important, that's great. But I don't want you to feel like you have to do a 10-minute presentation if you plan for 15.
Okay. All right, so folks, while we're waiting for just a few more folks to come and trickle into the room, if you wouldn't mind typing into the chat box, just type your agency, where you're from, and your role at that agency, so I can get a sense of who's in the room, whether it's filled with dental professionals or nurses or other public health folks. Thanks, Cheryl. Hi, Doug. I know where you work. Lots of friendly colleagues. That's great. Hi, Robin. All right, lots of NCIPHers in the house. All right, well, the chat has stopped buzzing, so I'm going to take that as a sign to go ahead and get started. So first of all, welcome. I am delighted to be here to share from my project team, which it was an academic practice collaboration between the oral health section and the North Carolina Institute for Public Health. I'll introduce the entire team on my last slide and tell you a little bit about this project that we worked on. I do want to tell you that I'm out in rural Chatham County, and my internet has a nasty habit of clicking off right at the most important moment. So just in case some horrible snafu happens and we all get disconnected, just know that I'll record this and it'll be posted in case we get cut off. So this session is about a course that the oral health section and the North Carolina Institute for Public Health developed together to train public health hygienists in the state of North Carolina. That by the end of our time today, you'll understand what some of the things that made our project successful working together. Understand some core tenets of the course and what it contains and what its purpose is, and also maybe learn a little bit about the role of public health hygienists in North Carolina and their role in expanding access to dental care. So for those of you who are not familiar with the role of public health hygienists, these folks are licensed dental hygienists, and they work within the standard scope of practice for dental hygienists, but they also do some more public health population-based work. The role of the public health hygienist is in North Carolina General Statute and Administrative Code, and it provides an enhanced scope of practice in that those hygienists who are formally designated as public health hygienists are allowed to practice without a dentist being present. There are many stipulations about who can become a public health hygienist. It has to do with the geographic area in which one works. If it's a dental provider shortage area, it also relates to particular areas of practice. So these hygienists can practice outside of the dental office in areas such as schools or nursing homes. There are certain minimum education requirements to become a public health hygienist, and they also must go specific training from the North Carolina Oral Health section to be certified, and that's the focus of our discussion today. So these hygienists, as I said, do regular clinical work, but they also go out into the community. Many of them practice in school settings. They may conduct fluoride rinse programs, offer preventive services, including screenings, varnishes, and sealants, or they may engage in community-wide activities, including screenings, oral health education, or sometimes also advocacy work, particularly around the area of community water fluoridation. This particular project to develop this course, the certification course for public health hygienists, came about because of a HRSA grant, which was awarded to the oral health section. When they put in for this HRSA grant, they reached out to NCIPH as an academic partner and some other academic partners. The focus of the grant is larger than just this one particular course. It's focused on a lot of different workforce development activities, both for the oral health workforce as well as for the clinical workforce, particularly those professionals working in safety net settings or who provide services to vulnerable and underserved populations. We're fortunate enough at NCIPH to also have a leadership institute for dental practitioners that's under this grant as well. So the hygienist course part of this had three particular phases to it. The first one was conducting a training needs assessment, which we did in 2018, 2019, and we had a little bit of support from the North Carolina AHEC program to do some of that work as well. I want to acknowledge that. The second phase, which was the densest, if you will, was to update the existing course that the oral health section had already. And the last phase was to take all of this new content and coursework and put it in a fully online format for the first time. So before I get into some of the details of the work itself, I want to talk a little bit about the partnership, because I think it really is a great example of an academic practice collaboration. There was complementary expertise between both sets of partners. The staff at the oral health section really served as subject matter experts. They are all dental professionals and dental public health professionals and have that subject matter expertise. They also, as you might expect, work with dental public health practitioners across the state and really understood that group of folks and the target audience and what they needed in the way of training. They also, as the certifying body for public health hygienists, had criteria for the course that was to be developed. And they also, fortunately for us, have a lot of workforce development and training expertise. So we were often speaking the same language together as we worked through this project. On our side at the academic institution, we obviously have workforce development expertise that we brought to the table, and all phases of workforce development. We developed the training needs assessment. Some of the folks who helped do that are in this session. curriculum design. In particular, we also have expertise in distance learning, both in developing e-learning content as well as working with learning management systems. And we actually had some of that infrastructure that we could bring to bear to the project. And we also, this was the first time we'd worked with the oral health section, but we had a number of similar partnerships and collaborations in the past that we could rely on. So, as I mentioned, we started off with a training needs assessment. This was an online survey that was focused primarily at safety net settings in the state. And by that, I mean community health centers, free clinics, and local health departments. It was directed at both oral health and medical providers. And we asked a lot of questions related to current and future training needs around some strategic skill sets, some technical skill sets, and tried to identify skills gaps. And by that, I mean areas where people identified an area of training as a high need for themselves with high relevance for their job and role, but felt that they had lower knowledge and expertise in a particular area. We reached some 266 folks overall, and out of that we had 241 informative responses across 55 counties, and out of all of the respondents, 60% were dental professionals. The survey asked a lot of questions beyond the scope of the hygienist course, so I won't go into those today, but if you're interested in the data, the report document is posted on the homepage of the oral health section, and you're welcome to go and take a look at that. The things that came out of it that are relevant to our discussion today were the skills gaps that were identified for hygienists. The top 3 gaps were around advocacy, having knowledge, a lack of knowledge about local resources to make referrals for non-oral health needs, and a lack of knowledge about providing oral health services in community settings. And by that, I mean outside of the dental office. We asked participants about supports and resources related to training. What you see here are specific to the dental respondents in the survey, and we asked them about where they go to for their trainings, who are their go-to providers, how they prefer to receive training. And I will just say flat out, this was conducted pre-COVID. I'm sure it would have a very different set of responses today. And barriers to getting out of their workplace to get to trainings, as well as incentives and supports for them to engage in professional development. As we went through the course development process, we really had 3 different phases. One was deciding what content should be included in the course overall, the actual conversion to e-learning modules, and building the course structure. As far as the content goes, we were very fortunate in that the oral health section did have a course already. It was one that was taught in a hybrid model where participants did some independent study, but they also made a visit to the oral health section for part of the content. There was also a very lengthy 10-hour course developed by the American Association for Public Health Dentistry, which had 10 hours of content in it. And so much of our work, and mostly on the oral health section side, was winnowing down the pre-existing content and meshing these 2 different sources so that we had one seamless curriculum. The overall goal of this course is to provide an introduction to public health and dental public health foundational principles, to provide an overview of dental public health in North Carolina, including the infrastructure of the oral health section, and also to provide some really practical resources and information around typical activities that public health hygienists might engage in, and also to provide information about providing oral health services to specific populations, ranging from early childhood to oral health care for school-aged kids, to care for special populations such as those with developmental disabilities or in institutional settings, in particular nursing homes. On the right is the final outline for the course. So we basically blended what had been a 3-hour course and borrowed from a 10-hour course and came up with a course for North Carolina that is 5 hours long, that consists of a series of e-learning modules. You can see the headers and topics here. The first module is very lengthy. About half of it is required, but the other half are optional modules, which a user may choose to take or not, and they can select how many of those they'd like to take. Our process for pulling all of these together included the review and updating of materials that I mentioned, but it was also developing the framework that you see in the picture here, developing learning objectives for each part of the course, and all of the ancillary materials that make up the course as a whole, including knowledge checks, which allow user interaction as part of the e-learning modules, quizzes, and the evaluation. As we went through, we tried to make sure that the course had a standard look and feel, regardless of what part of it you were in, and apply high standards of instructional design. We recorded them as streaming e-learning modules with the interactive knowledge checks that I mentioned on the previous slide. And we built the course structure around it, utilizing the learning management system that UNC uses, which is called Sakai, and embedded it in there in order to pilot the course. And as part of that, we developed an orientation module for users. And then we worked with the oral health section to coordinate overall application and registration processes. So we've been running this course since March of this year. We've had 3 cohorts go through it. The first one was just a couple of people, but they've grown in size each time we've run it. Overall, we have had 32 participants from 16 counties in North Carolina. And as you can see on the right, that graphic shows you where the participants are coming from. We've had a number of participants from community health centers, from academic health departments, local health departments, academic institutions. Those coming from academic institutions, as I looked at the data, were sometimes professionals in clinics, for example, in some of ECU's clinics out in different counties, or they are instructors in various programs across the state. State participants in this course came from both the Division of Public Health, but also from state institutions that have oral health programs, such as prisons and developmental centers. Most of the nonprofits seem to be free clinics or a couple of mobile dental providers. Early evaluation data from the course is highly positive, and we're really excited about that. Out of all participants, 96% were satisfied with the course, and out of that 96%, 87% were highly satisfied. 97% of participants agreed that the content of the course was relevant to their daily jobs. And we also asked for each of the learning objectives. Each unit in the course had 3 to 4 learning objectives. And for each of those, at the end of the course, we asked participants how confident they were in performing whatever the learning objective was. And results for that were high. The course increased their knowledge and skills level. And it was interesting in that for the required modules in the course, it was very high, 78 to 100%. But as we parsed the data, we noticed that for those optional modules in Unit 1, it really was much lower. For participants who elected to take those, their confidence level was much lower. And I think that's probably a combination of the topics of those modules, but also perhaps the fact that they're delivered in a different manner. They are not streaming modules. They are slide sets with narration that a participant reads. And I think those may just be less engaging and may stick a little less than the recorded modules. So next steps for this course, as I said, we have been hosting this at UNC, but that was just a temporary measure, and it is being moved over to the oral health section this fall to a learning management system there. They are also upgrading it to a different e-learning software. Since this project started, they found that they had access to technology product that has a lot more bells and whistles to it, and that I think will raise the quality of the program to an even higher level. And they are hoping to enroll the next cohort sometime late this fall and early winter. And I just wanted to pause and share this picture of all of the collaborators in this project. As you can see at the top, Jessica Scott, Rhonda Stevens, and Teresa Lewis from the oral health section, and myself and two colleagues, Lori Rue and Marcia Swartz from the North Carolina Institute for Public Health, were all involved in this project, carrying different pieces of it. And this project truly was a delight. We're very excited by the early response to it, and the fact that it will be distributed more broadly. And we also hope that with the recent changes in the North Carolina Administrative Code earlier this year, that it will allow the opportunity for even more dental hygienists in the state to take the course and become certified as public health hygienists. That's a very rapid overview of the project, and I'd be happy to answer any questions about this. For anyone who is perhaps wondering about how they might get into the course or have somebody in their agency get access to it, if you contact the oral health section, Dr. Stevens or Dr. Scott, they would be delighted to talk with you about the educational requirements and enrolling in the course. Thank you very much.
Thank you.
It's very quiet. Any questions in the chat box?
No, not that I see.
Okay. Well, it's been a pleasure being with you all today. Thank you very much. And I know that there are other sessions going on at NCPHA this afternoon, so I don't want to keep you from heading to some others, but thank you very much for your time.
Thank you. Thank you, everyone.